A rather worrying trend is taking shape on the local front as we make our way into a new normal amid the pandemic. Roughly half of all new infections in recent days are breakthrough cases here in the capital, Seoul. For more on this grim reality, I have Professor Chung Gi-seok from Hallym University. It is a pleasure to have you back, Professor Chung.
Good afternoon, Sunny.
I also have Dr. Alice Hyung-Tan from Miss Medi Women's Hospital. It is a pleasure again, Dr. Tan.
Good afternoon.
Right, Professor Chung, we'll start with you then. How does the rate of breakthrough infections involving COVID-19 vaccines compare to the rate of such cases for other vaccines, including the seasonal flu?
Well, first of all, we should not be very afraid of breakthrough infection because second, fully vaccinated rate is around 76%, and consider if all of us are vaccinated 100%, then every new cases will be a breakthrough infection. And first of all, the vaccine efficacy, in other words, the effectiveness is 70 to 90% according to a different vaccine. That means, in other words, about 10% or 30% of vaccinated people are prone to be infected. And if you, for instance, the flu vaccine, we do not measure a vaccine effectiveness in Korea, but according to a US CDC, they report every year about the vaccine effectiveness. And it ranges, surprisingly, from 10% to only 60%. So whether you got a flu vaccine or a COVID-19 vaccine, breakthrough infection happens. Don't afraid of it. But the vaccine, even though cannot prevent infection, but it can prevent the mortality and the severity. So you should get the vaccine despite any kind of breakthrough infection occurs.
Right, and staying with that, Dr. Dan, do compare for us the risks to health upon infection between vaccinated and unvaccinated people.
Right, I would say the bottom line is very clearly vaccination works and it's helpful and we should all get vaccinated. The reason why is because the risk of getting infected is 5 to 6 times higher in the unvaccinated compared to the vaccinated. And the risk of hospitalization and death is 11 to 12 times higher in the unvaccinated compared to the vaccinated. So this just echoes what Dr. Jung was saying. Vaccination, it works. No vaccine is 100%, but in terms of protection, the levels are still quite high.
Right, and talking about protection, with regard to breakthrough infections, Dr. Tan, what does science tell us about the protection offered by vaccine-induced immunity as opposed to infection-induced immunity?
So that's very interesting. So natural immunity, of course, does confer some degree of protection, but the epidemiologic and the immunologic evidence suggest that if you get vaccinated, fully vaccinated after natural infection, your immune levels are actually boosted to quite a much higher degree. It enhances your protection and it reduces your risk of reinfection. In terms of the data, there's a study out of Kentucky that studied a group of people who had all had infection with COVID-19. And then they compared the group of people who had infection, a history of infection, no vaccination afterwards, and people who did get fully vaccinated after natural infection. And what they found is people who did not get vaccinated after natural infection had a 5.5 times higher risk of reinfection compared to people who did get fully vaccinated. And in another study out of the United States, similarly, the odds of getting infected were much higher in people who just had natural immunity versus people who had full immunity after full vaccination. So the evidence is quite clear that immunity after full vaccination is higher than immunity after natural infection. But if you get vaccinated after natural infection, that actually causes a very high degree of protection.
Right, I see. Professor Chung, contrary to initial claims, I understand a breakthrough infection patient is just as likely as an unvaccinated person to spread the virus to those around him or her. Could you tell us more about this?
Well, unfortunately, it is true. Because the Delta virus is a very highly contagious variant, most highest one ever. And there is a study which have looked at the transmission rate among the households. If one is infected in a patient, she or he can transmit the disease to other family member. If one is vaccinated, it's 25%. Unvaccinated, 38%. A bit higher in unvaccinated, but not a big difference. If you know that the antibody does not prevent the viruses from proliferating on throat and nose, you can understand that. Because you have antibody in your body, within the body, not on surface of nose and throat. So you cannot prevent the viruses proliferate on your nose and throat, and then you can transmit the virus by coughing up or breathing. So it is conceivable that even though you are fully vaccinated, you can transmit the virus, even though you are not suffering from that disease. So even though you are vaccinated, then you have to wear masks and keep your personal hygiene in order not to transmit the virus when you are keeping to the other people.
Right, to ensure the health of those around you. Yeah. Dr. Dan, our new strategy of learning to live with COVID-19 places priority on medical stability. Having said that, what impact do breakthrough infections look to have on our medical system?
Well, we are seeing waning levels of immunity, especially 6 months after vaccination in people who are elderly and people who have immunocompromise. So it's going to be very important. I think a priority should be placed on administering boosters on for these two populations. So people who are 65 years and older, and also people who have any degree of immunocompromise, but especially if the degree is moderate to severe. So that is going to be an urgent matter that we need to deal with, in addition to, of course, vaccinating all of the unvaccinated people. In Korea, I mean, still there are millions of people who do not have full immunity against COVID-19. And so in order to prevent strain and potential collapse on our healthcare system, vaccinating and administering boosters to as many people as we can, as safely and quickly as we can, is still very, very important.
Right, and staying with the booster campaign, Professor Chung, you've been calling for a push that is in the pace with regard to Korea's booster campaign, claiming that the waning protection of those who received their vaccine earlier this year is quite a problem for the country. Could you tell us a bit more about your views on this? Right.
The data of doing a booster shot or not is mainly from United States and some from AstraZeneca in UK. Those studies are seeing the antibody level, not seeing a prevention power of Delta variants. So even though you have sufficient antibody until the 6 months after second vaccination, you cannot prevent Delta variants on your own. So according to Oxford University study, which have looked at the prevention power of Delta agent with Pfizer or AstraZeneca vaccine, in 4 months after second vaccine, the prevention rate decreased to 50%. So just all this, just 1 out of 2. So if it is true, then we don't have any reason why we should wait until 6 months after second vaccination. So current policy from our government is 6 months after second vaccination, aged 50 and older should be get booster vaccine. And if one is immune compromised, then in 2 months after second vaccine, they are entitled to get a booster. But most recently, our government released that 5 months instead of 6 months booster plan was released about maybe yesterday or the day before yesterday. I think it's a good direction, but I would like to suggest instead of 5 months, 4 months will be more appropriate in preventing Delta variants. The population should be 18 and over, all population, in 4 months. Then we'll have more power to prevent the COVID-19, especially through this winter.
Right. Right. At the moment here in Korea, Professor Chung, only those who receive the Janssen vaccine then are getting their vaccines earlier than 6 months, right?
Yeah.
Who receive the Janssen,
Yeah.
they get their booster shots earlier.
Yeah, I should say either Astra vaccine, which is AstraZeneca or Janssen adenovirus vector vaccine, or mRNA vaccine. I think both categories should have earlier booster vaccine in 4 months, not in 6 months, because the data says that you cannot prevent the Delta infection after 4 months. It's just less than 50% is not a big deal.
Right, I see. Which would make me eligible for a booster vaccine under your framework next month then, because I got my second shot in August.
Yeah, I recommend.
Dr. Dan, what are the factors now, the main factors that is, to consider with regard to infections as we chart a new normal? Because officials here, authorities here in the country have claimed we should not place too much priority on the daily tally and more on the number of severe patients and the fatality rate. What are your thoughts?
Well, you know, if you're dealing with a fixed ratio, the bigger your denominator is, the bigger your numerator is going to be. And so I don't think it makes sense to completely ignore the number of daily cases. Also, if we look at the breakdown in terms of the ages of the demographic of who's getting infected, that is a very high prediction of who's going to need hospitalization in the future and eventually who may die of COVID-19. So I don't think it makes really any sense to ignore the daily tallies. Of course, hospital occupancy, ICU occupancy rates are also going to be very, very important. But you know, up until this point, the number of daily cases has been a very good way to predict where the infection curves are going, and directly related to who's going to get seriously ill and who's going to die of COVID-19. So it is something I think that we still need to concentrate on.
Right. Professor Chung, when do you suppose now, moving ahead that is, will we witness the results of our shift in strategy on efforts to coexist with COVID-19?
Well, in short term, maybe mid-November, because that is about the time 2 weeks after total lifting of, I would say nearly total lifting of social distancing restrictions. And maybe by the end of this month, we'll see a continuous accumulation of COVID-19 patients. Then we'll see how the government is coping with very severe patients and the death people. So the scorecard should be very good, but I'm afraid we are not seeing a very nice report from the government side.
Right. Dr. Dan, there's been a visible rise, I understand, in the number of para-influenza patients here in the country in recent days, with most of the patients under the age of 6. Now, I understand such an outbreak is normally witnessed in the summer. Could you first then tell us a bit about the para-influenza virus, its symptoms and treatment options?
So the para-influenza virus is actually one of the most common causes of acute respiratory illness, especially in children. It's actually causes 60% of all acute infections in children less than 5 years old in developed countries. I didn't know this, but it's actually a very, very common cause of illness, of infection in children. It can cause both upper and lower respiratory tract infections, so it can cause something called croup, bronchiolitis, and even pneumonia, so severe respiratory illness. Unfortunately, there's no specific antiviral treatment for para-influenza illness yet. Basically, it's supportive care. They can use oxygen mist, nebulizer treatment, corticosteroids to bring down any inflammation due to the virus. And also there's no vaccine against this virus as well. So the good news though is that it doesn't have a very high mortality rate. Most children do recover, but they could be in hospital if they have a severe pneumonia for over a week. And so it is something that we need to keep an eye on, and for parents of small children, just make sure that they're washing their hands very frequently for 20 seconds with soap and water. Make sure that they're not around any friends who are sick. and mask wearing will help with parainfluenza virus just as it's helping with COVID-19.
Right, especially as we're planning to reopen the academic arena fully in November, by November 22nd. Do you think the academic arena is ready for that opening?
Well, you know, Korea has had a very strong management of COVID-19 compared to other countries around the world. I think in terms of its impact on the education sector has been less in Korea compared to other countries. I know that the teachers, school administrators will continue to do everything they can. I know parents and teachers will continue to do everything they can. And children actually have a very high compliance rate with wearing of masks, and they will do what you tell them to do. They will wash their hands. They will, you know, try to stay away from anyone who's sick. And I think parents are very compliant with making sure their children are well before they send them to school. So I'm crossing my fingers that November 22nd, you know, we'll have the green light. But on the other hand, I'm looking at the numbers, and they are increasing in terms of deaths as well due to COVID-19, and that's quite concerning to me. Yes.
Right. And Professor Jung, going back to the para-influenza here in the country, how do you explain the spread of this so-called, I understand it's called the summer cold. How do you explain its spread well after its season?
Well, I think we have prepared some graphics regarding parainfluenza viruses. Look at the graphic over there. That is a human parainfluenza virus occurring for past 3 years. So 2019, we saw a peak coming off around May and June. That's why we are saying summer influenza. But for adults, I don't think the parainfluenza is a big deal because we don't care much about the parainfluenza thing because that's very mild. Most people do not come to a clinic because of a parainfluenza infection. That's the routine job we are doing in hospital, but also in Korea Disease Control and Prevention Agency are reporting weekly about the occurrence of parainfluenza, and also includes 8 different very common viruses in the society. So if you look at the flu curve, that shows the last year we didn't see any occurrence of influenza at all. But 2 years ago, we saw a peak, a first peak coming off during winter time, and the second peak coming off on spring. That spring is influenza B type, and during winter time, those are mostly influenza A type. So the thing is, are we going to have a flu pandemic, endemic this year or not?
The twindemic, exactly.
Yeah, last year we were quite afraid of occurrence of twindemic with the flu and COVID-19. Everybody got a flu shot. But this year we have to be very cautious again because last year we didn't have any influenza endemic, epidemic all over the country, but all over the world. Quite many people has no immunity, no natural immunity against influenza. So if influenza circulates in the society, many, particularly young adults, will be infected because they didn't even expose last year. So it is probable, but the course of influenza coming to our body and our society is twofold. One is already circulating virus in our society. The other one is importing from abroad. So still, we don't have a frequent communication among international countries. So I don't think there will be a very severe influenza epidemic this year.
Hopefully you're right.
Yeah.
Dr. Tan, let's wrap up today then with what you believe individuals can do to better protect themselves from breakthrough infections as we head into the colder months of the year.
Right. So if you've not been vaccinated, get vaccinated. If someone you know has not been vaccinated, help them get their shot. If you're eligible for your booster, please sign up and get your booster. I think that's number one. And now that physical distancing, social distancing has been decreased with the easing of restrictions, I think it's just that much more important that we do all of the personal hygiene and infection prevention behaviors, such as mask up, wash up, washing your hands, ventilating your indoor spaces also is going to be very important. And then the next component, of course, is testing. So if for whatever reason you just don't feel well when you wake up in the morning, and it could be very subtle, you feel tired, you feel achy, you might have a mild fever, don't rationalize, just get tested. And if you have any social engagements that day, just cancel. Just cancel. It may be nothing, but it may be COVID. So just cancel those appointments. And I know that your friend will be so grateful for you to have canceled the appointment if it ends up that you actually had COVID, because you've now prevented a breakthrough infection.
Right, because prevention is better than cure.
Yeah, absolutely.
Right. All right, Dr. Dan, as always, thank you very much for your thoughts. And Professor Chung, thank you very much for your insights.
Thank you.